Hey, it looks like no one else is in the waiting room, so welcome everyone to the BC Health Coalition annual general meeting for 2023. So I'm Tuesday Andrich. I am one of your labor co-chairs. I'm with QP British Columbia, the Canadian Union of Public Employees, BC. And I am here to start us off. I'm going to give us a land acknowledgement first off the hop. So the BC Health Coalition acknowledges that we are based on the unceded and traditional territories of the Coast Salish nations of Musqueam, Tsleil-Waututh, and Squamish. We also acknowledge the many territories and lands across Turtle Island that you are joining us from. We're honored to be here as guests on this land that Indigenous peoples have cared for and continue to care for since time immemorial. We invite you to take a moment to think about where you presently live and honor the people of the land. Think about your relation to the place you live, work, and interact. This is our inquiry to honor the past and present and to stay connected to decolonization practices. We invite you to use the chat to share the name of the territory or land where you are connecting from as part of this acknowledgement. So just as an FYI for everybody, this meeting is being recorded. Registrants will receive a link to the recording after we're finished here. And please mute your mic if you're not speaking. And just a little housekeeping note, the bylaws state that voting members are organizational members with one vote per organization. Individual members can participate fully in the AGM discussions, but do not have voting privileges. This also applies to motions like approving minutes. If you are an organizational representative, rename your name on Zoom with your first name and then your organizational name. This will help us keep track of votes. And in order to do that, you hover over your video square, and in the top right-hand corner, there's 3 dots. You can click on that, scroll down to rename, and then you can rename yourself that way. So please use the raise hands feature in Zoom to be put on the speakers list or for any voting. We won't be able to count your vote or add you to the speakers list if you're physically raising your hand. So the raise hand button can be found at the bottom of your screen. You'd click on, well, for me, it's more, and then it's reactions, and then it'll show you the raise hand. And then I will hand it off to Stacy. Is Stacy here?
So my name is Stacey Ashton. I am the Executive Director of the Crisis Center of BC here in Vancouver. And I'm currently in New Westminster, which is the unceded territory of the Kakite First Nations, alongside the Hamalkamalan speaking peoples. And I'm also the chair of the BC Crisis Line Network, which is the collection of 10 crisis centers across the province that are answering 988 and the provincial crisis lines. So so I represent the BC Crisis Line Network here at the BC Health Coalition, and I get to call the meeting to order here at 1:08 p.m. on Wednesday, December 13th. Hello. So I think we've seen the agenda, and I'm just going to ask for any feedback on the agenda. Is there anything that folks want to ask about or change or anything like that before I ask for the agenda to be approved? Okay. So seeing none, can I ask for a motion to approve the agenda? Thanks, Colleen. And I think I need a seconder. Thanks, David. So all in favor? All right, looks good. So that has successfully been done. So, and then we have the 2022 AGM minutes. So you should have gotten those in your packages. And are there any feedback on those minutes? Hey, Andre has just shared a file, so you can grab it if you need to. I'm just going to give like another 10 seconds or so for folks to, if you haven't taken a look at it, to find out if your name has been spelled correctly or incorrectly. All right, so if there's no feedback, I'm going to get someone to give me a motion to approve these minutes. And it looks like Tuesday and Phoebe's will second. Awesome, so all in favor? Okay, and that looks good. Woohoo! I get to turn it over to Lisa.
Thank you, Stacy, and nice to see all of you on the call. My name's Lisa Freeman. I am one of the labor co-chairs of the steering committee for the BC Health Coalition, and I'm a representative from the Hospital Employees Union, or HEU. And what I'm going to do today is I'm just going to share a little bit of some of the materials that are in your package, just a brief summary of some of the highlights from the message or the letter from the co-chairs from Tuesday and just to highlight some of the great work that the coalition has done this year in terms of campaigns. So it's really been a new chapter for the BC Health Coalition for organizing and advocacy since the decision made by the Supreme Court in 2023 in April around the Canby case and dismissing the appeal from Canby. And so that's really given the coalition an opportunity to think, you know, that was such a focus for so long and such a huge case, and to work on new and exciting things. So the coalition's continuing to work with the Canadian Health Coalition and the Council of Canadians to advocate for public pharmacare, and is continuing to advocate for public health care, publicly funded and equity-driven system that's supported and delivered by our healthcare workers, a lot of whom are members of the coalition. And if you look to the campaign section of one of I think it's the annual report that Isman sent out, the coalition has done a lot of work, even though the Canby was such a big case, and are still thinking of next ways to go, work to do. In terms of seniors care, there's been a campaign call for funding reform of how the government has the funding and how we can see what it is. So a call for transparency. The seniors care groups have also organized a great presentation, and some of you are probably there, in November, from the seniors advocate, who spoke about her new report about billions more reasons to care, and talking about what's happening in seniors care in terms of where the money's actually going and where we don't always know where it's going, and kind of saying we need more transparency for that. And that was also, in that event, there were some people from the Families Council that gave great presentations, as well as the president of HEU, Barb Netterpaul. The coalition's continuing on anti-privatization work, finishing up with the Canby case, dealing with the ending of that, and also working on not-for-profit or against for-profit healthcare, and kind of questioning some of the private billing things that are going on, and continuing to stand for public healthcare and pushing for increased federal healthcare funding, and continuing to work with and support the Council of Canadians with the PharmaCare project, as I mentioned. And I think the staff have a BC Health Coalition 2023 review video where you'll get a bit more details of the things I've just very quickly and briefly reviewed, and I'll pass it on to staff to show that video.
There's questions about the effectiveness of that model, and also questions around have people who use drugs been consulted around this shift.
It's possible that TELUS was operating in a gray area, and because of that now people have been able to pay their way to securing a family doctor, and of course that's unfair.
Well, I can confirm they are working on a funding model. The work is slow.
Thanks so much, Audrey. That tune will be in my head for a while. I love it. And now I'll pass it on to Usman to present the 2022 financial statement, or 2023.
Thanks, Lisa. Hi, everyone. My name is Usman. For those of you who don't know me, I'm the coordinator with the BC Health Coalition. So I'm going to present the end of year financials for 2022. So not this year, just to be clear, but last year, because we haven't finished we haven't finalized our financial statements for this year yet. So what I'll present is a condensed overview of the statements. I'm happy to answer any questions. I'm also happy to provide our more detailed financial statements, but those statements and the work of making sure the Health Coalition is in a good fiduciary condition is done by our finance committee, which is part of the steering committee. So I'm presenting this on behalf of them. So I'm going to share my screen, and I won't go over every line, but I'll just make some highlights. So what I'll start with is our revenues and expenses for last year, and you'll see that we balanced our finances for last year. So we ended up we broke even just about, but I'll explain a bit more about that later. So just some highlights around our revenues. So we ended up with total revenues last year around $358,000. Of that, the bulk of our revenues were really the organizational donations, which totaled almost $300,000, $293,600 to be exact. And those are donations both from steering committee members as well as other organizational members. So really that's the bulk of where we received our funding from, and then a smaller portion came from individual donations of around $20,000. On the expenses side, we ended up with $358,000, $381,000 in total expenses, which the vast majority of it were, as you can see, in staffing expenses, totaling around $300,000. So really, and I think this is usually the case for the Health Coalition. The staffing expenses make up the bulk of our expenses annually, and that was certainly the case last year. Operating expenses and campaign activities were also part of our expenses, but a smaller portion. So that's our income and expenditure statement. But what I want to point us to is actually this figure here. So these are deferred revenues from 2022. And so this was actually the surplus that we had at the end of the year in 2022. We had a surplus of around $24,000. Now, it doesn't show up in our income and expenditure statement because that surplus was deferred to 2023 and made part of our general operating budget. So, you know, when we present our 2023 numbers, we'll talk about what we did with that surplus that carried over from 2022. The other deferred revenue I want to talk about is our legal defense project. So our legal defense project is a separate revenue stream specifically created for fighting the Cambie legal battle. So we carried over revenue of $276,000 from 2022 to 2023. And at the start of 2023, we had we were fully expecting to keep using that legal defense fund to keep fighting the Cambie legal battle. But obviously, as hopefully you all know, we had to we won that case, and so this year the finance committee had some discussions around moving that money into longer term investments with our bank. So again, I'm happy to share more of those details, and when we present our 2023 numbers at our next AGM, I'm happy to share that information. But just wanted people to know that we are thinking about how do we invest that money so that we can have guaranteed income in the future. The final thing I'll highlight is we do still have total retained earnings of around $61,000, and so that represents sort of our a rainy day fund or the sort of the emergency cash on hand that we have as an organization, and so depending on what surplus or if we end up with a surplus in 2023, we may want to think about potentially upping the total retained earnings, because in the past we've tried for that figure to represent 25% of our total expenses for the year, and I think it's slightly below that for 2020. Looking at the 2023 numbers, it's slightly below. So again, something for us to think about as we approach the end of 2023 is potentially adding to that total retained earnings. So with that, I will stop sharing my screen, but I'm happy to answer any questions folks might have, and you can go ahead and unmute yourself, and I'm happy to field any questions. Go ahead, Agnes.
Hi, Usman. I'm just wondering, under revenues, the third item down, which for 2022 shows $3,553.30, and that's down from the previous year of $10,400 and so on. And I'm just wondering, does that indicate that we have lost individual members?
Yeah, so that's a good question. It doesn't actually indicate we've lost individual members. It's actually just the way we changed how we tracked donations coming in. Instead of we focus on individuals making donations as opposed to individuals buying memberships, because we found actually that people donated more when they made a donation as opposed to joining as a member. It doesn't mean they can't still join as a member. And what isn't reflected in this statement is that many members joined, without necessarily donating to their membership, but then they made a separate donation at another point in the year. So if you look at the line actually below the one you cited, we had a slight increase in the individual donations we received in 2022 versus 2021.
So do we have any way of tracking how many members we actually have? Because
we have our own, like a finance backend where we track memberships and yeah, I'm happy to share those numbers with you at another time, but I'd have to pull them.
okay, thank you. Because I know, we put sort of emphasis on our organizational members, right? But I think it still has a value that we're able to tell people, how many individual members we have as well.
Yeah, no, that's a good point. And these are the numbers from 2022. In 2023, we did actually do, like in 2022, we didn't do things like a direct mail out to individual members, which we actually did do this year. So I think we'll see a shift in those numbers, but I agree, like there's value in individual members as well.
Okay, thank you.
Go ahead, Margot.
Yeah, just congratulations on the Cambie legal battle. That's just amazing. That's a large amount of money. I'm curious as to where that came from. It's pretty close to your operating budget. And secondly, could that be precedent setting, and that you may pick up other issues like that and turn them into a legal battle? Especially I'm thinking of, for seniors, some of the inequities that we know we have in this province. So I'm a bit curious about the history and where that came from.
Yeah. So that was really, fundraising and donations from the past 14 years in the legal battle. So the bulk of that came from labor partners, particularly labor partners in BC, but it also came from individual donations, organizational donations, and we did a lot of I think it varied over the course of the 14 years, but at least for the last few years, we did a lot of that fundraising together with other interveners in the Cambie case, particularly the Canadian Doctors for Medicare. So it was really a joint effort, but yeah, the bulk of that came from labor donations over the years, and yeah, it's a big chunk of money, which I think one of the things that now that the Cambie case is over, one of the items for our steering committee and the finance committee to figure out in collaboration with everyone is what do we do with that money?
Great. Thank you.
Go ahead, Audrey.
Just as a point of information in response to Agnes's question, I just looked it up, and we currently have 557 active individual members.
Thank you.
So I'm not seeing any other questions. So if there's no other questions, going once, twice, 3 times. If there's no other questions, I'm going to invite Diane Wood, who's the Costco representative on the steering committee and the chair of our finance committee, to call for a motion to approve these financials.
Thank you, Osman. I would now call for a motion to approve the 2022 financial statements of the BC Health Coalition, and there will require a seconder. And I see Agnes has her hand up as a seconder. Thank you. Any more discussion on the motion? If not, then I guess we'll call for the vote. Could all please signify approval? And we can now lower our hands. And is there anyone opposed? Still see some. No opposed? Thank you. That motion is carried. Thank you, Usman.
Thanks, Diane. Tuesday, go ahead. No, sorry, I was just going to pass it to you.
Jumping the gun there. Okay. All right. Hi, everyone. So now I'm going to announce that the BC Health Coalition has created a new strategic plan for 2023 and 2025. So the strategic plan guides the governance, organizing, and campaign priorities of the coalition. BC Health Coalition staff, steering committee members, and members from our anti-privatization and seniors care advisory groups all contributed to this plan. The plan was also taken to the advisory groups to give all advisory members a chance for input into the plan. And we'd love to share with all of our individual and organizational members this plan as we look to next year. So I'm going to pass this on to Audrey to share the plan with us today. Thank you.
Thanks, Tuesday, and I'm going to go ahead and share my screen. I have some slides to share. What I'm going to do though is focus on primarily on the campaigns part of the strategic plan. There's three main areas of planning priorities and objectives, and I'll invite everyone to check out our annual report because the full strategic plan is included in details. But I'll just give a bit of an overview of the governance, communication, and organizing pieces, and then focus a bit more on campaigns. So you'll see that under governance and communication, there's some unsurprisingly governance piece objectives. So some work to clarify the roles, responsibilities, memberships, expectations, and action plan for different bodies at the Health Coalition, including the steering committee, working in advisory groups, and different ways members contribute. And so that work is ongoing, including if you bump down to the last item on this screen, reassessing the governance structure of the steering committee to provide a bit more clarity for steering committee members about the roles of the steering committee. And so that is also still ongoing. And then there's just two other things in this category, including engaging in ongoing learning about reconciliation and decolonization as an organization, and the communications objective to really focus on creating opportunities to uplift members' work, as well as having better ways to communicate out on BCHC campaigns to support our member organizations in participating in our campaigns. And so my one note on that piece is that if you as an organization are working on something specific and want the Health Coalition to help support that and uplift that work, please never hesitate to reach out to Health Coalition staff, and we'll be happy to talk about how we can do that well. The next category that I'll kind of breeze over, I mean, they're pretty straightforward pieces as part of our organizing objectives. We do think it's important to improve the Health Coalition's media presence. And yeah, so that's going to be a strategic priority in the next couple of years. And we also want to expand our presence beyond Metro Vancouver. And so that's part of our organizing strategy, is to connect more to organizations and leaders who are on the ground in different places outside of Metro Vancouver to support local organizing efforts there. And then continue to build alliances across sectors, organizations, and communities. So I think that's all I'll say upfront about the governance, communications, and organizing pieces, and just what I think most people here are the most interested in is kind of what campaign focus areas the strategic plan identifies for the next couple of years. So this piece of the strategic plan explains a little bit more what we mean when we say primary, emergent, and amplifying campaigns. So those are different ways that we categorize how much capacity the Health Coalition would devote to campaigns. And so primary campaigns are really the ones that the Health Coalition takes a lot of initiative and leadership over and develops them ourselves, and kind of where we spend the most of our times and efforts. And so this campaign area has to do with the anti-privatization part of our work. So for the Health Coalition to promote public ownership in healthcare and to educate on the dangers of private solutions, such as contracted out. Maybe one day we should get into the details of the Medicare Protection Act and the legal mechanisms to protect the public healthcare system and protect extra billing and things like that. That's probably a bigger conversation that we have time for today, but the long story short is that we want to have better enforcement of our Medicare Protection Act to protect from illegal extra billing. Continuing to promote public solutions that address problems in healthcare, and we really see anti-privatization and the promoting of public solutions as two sides of a coin, and that we're not just against privatization, but we are for public solutions that have been proven to be effective and are based in evidence. So that's this area of campaign focus, and the other focus of a primary campaign is to continue to advocate for solutions in seniors care coming out of the public crisis in long-term care and home support. Those really are the two main areas of focus in our seniors care work. And so you've seen a lot of work on long-term care reform, particularly more recently funding reform in long-term care, and so that will be ongoing. But really, we know that there hasn't been enough focus on improving home support and access to publicly funded home support, and so that you should expect to see more focus on that moving forward as it's part of the strategic plan. And I think this might be the last piece here, but no, it's not. So the other primary campaign focus will be really looking at the provincial election coming up next year, and wanting to really engage an election, engage our constituency leading up to the election. And so there's some specific objectives having to do with leading that out, and you can expect, especially starting early next year, some engagement from our part around priorities for the provincial election. And then I mentioned there's different categories of campaigns. This is an emergent campaign focus, so those are kind of like new and developing campaign areas. And there's some direction to focus on recommitting to primary care reform work, including the focus on community health centers as a promising model. And so we haven't kind of relaunched public work in this area, but have been working so far behind the scenes to reform a primary care working group. And so that's up and coming as well. And then there's some research focus on financing models and healthcare spending priorities that we're also working on with some researchers and policy experts. We're also, again, behind the scenes so far. And then the last category of campaigns is amplifying, and these are campaigns that the Health Coalition doesn't really take as much initiative or leadership on, but we do partner with organizations who are more experts on the matter and amplify their work. And so that's where the work of on mental health and substance use kind of falls, is continuing to amplify the leading voices in those areas and to build relationships with those organizations so that we can do that well. And of course, there's connections as well about primary healthcare, and primary healthcare that includes mental health and drug policy in a good way. It's in early stages of weaving that together, but that'll be important moving forward. And I think that's it for me. So I'll stop sharing my screen, and maybe, I don't know if we have time for, I'll leave it to Tuesday to see if we have time for questions.
We do have just a minute or two for questions if anyone has one. Keep it short and sweet, please. Give me just a minute. Okay, seeing none. So we're going to move now to other business. So this is the part of the meeting where members are allowed to bring resolutions to the AGM. So a resolution requires to be submitted with the support of 3 organizational members. And one of these members must be present in person to present the proposal at this meeting. So it's my understanding that we do have a couple voting, 3 voting members of the society who have sent a notice of a matter to be considered. But just a couple housekeeping items first. So the proposal will be presented, and then according to rules of order, discussion will take place after I open the floor for discussion. We have 10 minutes to discuss the resolution, and at the end of the 10 minutes, we'll take a vote on the resolution, and a simple majority of organizational members present at the AGM is required to pass the resolution. No other resolutions aside from this one that we know of have been submitted for consideration. A reminder that only organizational representatives are voting members of the society, so only they can vote. However, individual members can speak to the resolution. We ask that comments be as limited as possible, no more than 2 minutes, to allow for as many voices to speak as possible for the resolution. If you end up going more than 2 minutes, we'll ask you to wrap up your points. The BC Health Coalition staff will maintain a speakers list. If you'd like to be added to the speakers list, please use the raise hands function on the Zoom located at the bottom of your screen. This is your notice to get ready with that. You will be added to the speakers list based on the order in which your virtual hand was raised using the raise hands function. And please note that we do only have 10 minutes total for the discussion, so we may not get to everyone. So with all those housekeeping pieces in mind, I'd like to invite the organizational members who have submitted this resolution to please present the resolution. Just a reminder, this is just presenting the resolution. I will have to open the floor for discussion, for further discussion. Thank you.
Hi, I guess that's me.
Thank you, Colleen.
Organizations that move the motion. Should I read the motion?
Yes, please.
Okay. Whereas the events in Israel and Gaza have deepened an ongoing humanitarian crisis in the region, including an estimated 16 to 20,000 deaths, 60% of them women and children. And whereas refugee, humanitarian, and medical organizations now rank the attacks on the Gaza Strip, an area the size of Texada Island, amongst the worst assaults on any civilian population in our time and age. And whereas repeated attacks by the Israel Defense Forces on medical facilities, personnel, and transport have brought Gaza's healthcare and hospital infrastructure to the point of total collapse, therefore be it resolved that the BC Health Coalition join the PSAC, CUPE National, CUPE Ontario, Unifor, CUPW, NUPG, many Council of Canadians chapters, the Canadian Centre for Policy Alternatives, the Reach Community Health Centre, the BC Poverty Reduction Coalition, the United Nations, the World Health Organizations, MSF, Doctors Without Borders, and many others in calling for an immediate and permanent ceasefire in Israel and Palestine, the release of all hostages, the withdrawal of illegal settlements in the West Bank, and the flow of humanitarian and medical aid to those who need it. And be it further resolved that the BC Health Coalition join the Ceasefire Now coalition.
Thank you, Colleen. Are you moving the resolution as well?
Yes, I'm moving the resolution.
Great, thank you. And then do I have a seconder? I see a bunch of hands here and I'm assuming that's for discussion, but I do need a seconder. You can just shout it out. You can just shout it out. Barbara, are you seconding it? Okay, great. Okay, now it's moved and seconded. It is on the floor and I'm opening the floor for discussions. Reminder, 2 minutes, please. I see Barbara is first. So please go ahead and we'll start the timer.
Sure. So I want to say that first I'm on the Esquimalt and Songhees Nations land right now. The Victoria Council of Canadians and myself definitely endorse this recommendation. I'm a secular Jew, and I'm asking all of you to give your support. to an immediate and permanent ceasefire in Israel and Palestine. And although no resolution is ever perfect, it is important that we all pass this resolution. Many here at the BC Coalition will want this resolution to include a lot more, and many would like this edited. However, nothing is perfect, and it's important to vote yes for this resolution. And for all combined healthcare wants and experience, we know there are rich and powerful lobbyists pushing their opposing agendas. And we need to join with like-minded people, social justice organizations, unions, to endorse our voice in saying a ceasefire needs to be now, as war is never the answer. Thank you.
Thank you, Barbara. I see Sasha.
Thank you, Tuesday. Good afternoon. I'm speaking on behalf of Rowan Burge, who is the Provincial Director of the BC Poverty Reduction Coalition. Rowan couldn't attend today, so I'm sharing a few short remarks on their behalf. The BC PRC is a coalition of 80 member organizations, many of whom share affiliates with the BC Health Coalition. And we've signed on to the Ceasefire Now statement, which the BC Health Coalition is considering. The loss of civilian life in Gaza is staggering and continues to grow. The destruction of hospitals, refugee camps, the killing of journalists and healthcare workers, and the extreme shortage of food, water, medicine, and fuel have put the entire population in danger and have horrified the world. The BC PRC unequivocally condemns this targeting of civilians and supports an immediate, permanent ceasefire. We also want to make clear that anti-Semitism, Islamophobia, and hate in all forms have no place in our organizations and our movements. We strongly urge the BC Health Coalition to join over 260 organizations across Canada to take a strong leadership position on this issue on human rights abuses and to actively condemn the genocide occurring against people in Palestine. Health workers across Canada are echoing the call for a ceasefire and leading on-the-ground organizing for a wider community to show up in solidarity. They recognize the devastation that's occurring on the ground, and particularly at hospitals and sites where civilians and healthcare workers are supposed to be safe under international law. We're witnessing a humanitarian crisis, and the bombing must stop now as a first step towards a just and lasting peace. Both as anti-oppression and human rights-based organizations, and also as settler-led organizations on unceded lands, it's critical to leverage our power as organizations to stop the violence by endorsing a permanent ceasefire now. Thank you.
Thank you so much. Just right under the time too. Love it. Okay, so I see Scott's hand is next in the queue. Please go ahead.
Good afternoon, everybody. I definitely do support this motion. However, I do have some concerns. Is this within the mandate of the BC Health Coalition, and is this part of the role of the BC Health Coalition? And I would like to see the steering committee review this to see if it fits with the goals and the plan of the BC Health Coalition. I personally support this. However, as a representative of my union, once we sign on to something, it's very difficult to unsign. And for whatever reason, I don't imagine why we would want to unsign, but it's one of those things where I just feel that this might not serve the best interest of the work of the coalition, even though this is an international issue, and my heart goes out to everyone involved in the conflict. But yeah, so I'm making a motion to refer this back to the steering committee with instruction to review it to see if it meets the mandate and the goals of the BC Health Coalition. Thank you.
Okay, great. So we have a motion to refer. That means original debate will cease. Remind me, do we have debate on a referral, or does it go to an immediate vote? One of the union-y folks, please let me know.
A motion to refer is non-debatable.
That's what I thought. Thank you so much, Diane. Okay, so now we are going to an immediate vote to refer this motion back to the steering committee. So everyone hands down. Oh, wait, we need a seconder. Do we have a seconder to refer? Are those hands as seconders to refer? Okay, so we have seconder moved and seconded. Now we'll move to the vote. Hands down, please. Okay, do we have show all in favor to refer to the steering committee? Please show your hands. Okay, BC Health Coalition staff, can you please make note of how many so that we can accurately.
Just hold. Can we leave hands up for just a little longer, and I'll let you know when I'm done counting.
Thank you. Hands up, please, still, if you are in favor of the motion to refer to the steering committee.
This is Linda Wilson. My hand's not working for some reason. Can you consider me having a hand up?
Got it. Thank you, Linda. Thanks for letting us know.
Okay.
Awesome. Thank you. Okay, hands down, everybody. Larry, could you please take your hand down? Thank you so much. Okay, all right, hands are down. And now everyone opposed to referring this motion back to the steering committee, please raise your hands now.
Okay.
Okay, hands down. To me, it looks like it has passed. Audrey, would you say that?
Yeah, and I just want to note that I only counted the organizational votes and 1 per organization, but it is 13 in favor of referring and 6 opposed.
Okay, all right. So the motion has now been referred back to the steering committee. All right, thank you, everybody. So, all right, that ends this portion of the meeting. So now it looks like we are up to a break. We have a 5-minute break before we move into the second half of our meeting. So individual members, thank you so much for joining us. Organizational members, please stay on. We will be moving to our labor and community caucuses for further discussions.